I wasn't able to night drive. I didn't trust myself. To watch TV was difficult. My husband and I watch a lot of pro golf on TV. To see the leaderboard, I'd have to get up out of the chair and walk within 5 feet of the TV to see who was leading the tournament.
Colors weren't very bright and my vision was foggy. And when I would look at things, it wasn't very clear.
I'm a big crafter. I love to paint. I do make my own greeting cards, and I golf. And I couldn't follow the golf ball when I was on the course. Not being able to choose the colors with the vibrancy that I needed to have. For painting, I wasn't doing that anymore. Actually, I just felt like the fun was taken out of life.
Many people feel that their eyesight is priceless and that their vision is the most valued of all the 6 senses. As we get older, however, cataracts can cloud our vision and make everything appear hazy or smoky.
Is that better or worse?
That's better.
Okay.
It can become difficult to read, recognize faces, drive at night, or simply get around. There is no known treatment to reverse the growth of cataracts, but surgery to remove and replace the clouded lens is extremely common. Making cataract surgery safer and more effective, Dr. Larry E. Patterson and his Eye Centers of Tennessee are early adopters of a technique called refractive laser-assisted cataract surgery, also called RELAX. This technique can literally take you from seeing through the fog of a cataract to living life clearly with reduced dependence on glasses.
For years we've done cataract surgery manually by hand with blades and scalpels and needles and things like that. What RELAX allows us to do is to perform many of the manual components of the surgery with the laser.
Traditional cataract surgery has been among the most successful and highest volume procedures in the U.S. for years. A cataract is the clouding of the natural lens of the eye. A capsule surrounds the natural lens with the cataract. The lens and cataract must be carefully removed from the capsular bag while leaving the capsule intact. The main incision is made in the cornea by hand with a sterile, sharp metal or diamond blade. The cataract is then broken into segments using ultrasound and removed. A replacement intraocular lens, or IOL, is then implanted. The outcome depends heavily on the skill of the surgeon.
Try to draw an absolutely perfect circle. That's essentially what we do in cataract surgery. One of the steps is with a needle we puncture the capsule that surrounds the cataract and we try to tear an absolutely perfect circle. And while we generally come close, it's never perfect.
By introducing the LensX laser to perform the capsulotomy, it not only performs the incision in a matter of seconds, it increases the accuracy of the incision. In fact, in about 99% of cases, the capsulotomy performed with the laser have a perfect diameter, position, and centration.
The current thinking is all of this being done with the laser as opposed to by hand is going to give us a more precise, accurate result, giving the patient a greater likelihood of being able to not only see better, but to be able to see clearly without glasses.
Cataract surgery with the LensX laser has been shown to be gentler for the eye and more efficient with better, more predictable visual outcomes than conventional surgery. Mr. Bridges has chosen to have the RELAX procedure and will be going into surgery later today.
Well, I'm just hoping that my distance vision will be better. And I've always worn glasses, and I think I will continue to wear them even though I might not have any corrective lens in for the top.
During RELAX, numbing drops are instilled and a speculum is used to hold the eyelids open. A seal is made with a contact lens and gently suctions to the eye to prevent any accidental eye movement. Once the eye is aligned, a detailed scan is made of the cornea and lens of the eye. The orientation, size, and shape of the main incisions are programmed into the laser and then precisely etched into the cornea. The laser then delivers a series of pulses to a pre-designed pattern based on the density of the cataract. There are separate operating rooms for the laser procedure and for the removal of cataract and IOL implant. The entire procedure takes about 10 minutes. and the total time at the surgery center is about 1.5 hours.
Right after the surgery, when I walked out of here, I could see better then than I had in years. Also, the next day I came in for my follow-up checkup. I was seeing 20/20, and I find that amazing.
I had never imagined it would be that different. The colors are just amazing. Before, I didn't really notice the colors. I mean, I could see the difference between the different shades, but now everything is just bright and alive.
Eye Centers of Tennessee's primary location is in Crossville, Tennessee, with 4 other satellite locations throughout the state. Laser cataract surgery does require some extra services that are not covered by insurance. There is an extra cost to the patient. After laser surgery to remove their cataracts, many patients experience the moment of wow, an exhilaration that the fog has been lifted and their eyesight is dramatically improved. At Eye Centers of Tennessee, they are hearing the word wow many times a day as their advanced relax surgery clears away the haze of cataracts and returns the priceless gift of vision with less dependence on glasses. For more information about the Eye Centers of Tennessee, log on to www.ecotn.com.